For centuries, medicine was limited by our inability to see inside the living body. The invention of medical imaging transformed this landscape. Imagine peering through skin and bone, visualizing organs and tissues in exquisite detail. This is the power of medical imaging, a window into the human body that has revolutionized diagnosis and treatment. Before the advent of X-rays, understanding internal ailments was a guessing game. This all changed in 1895 with Wilhelm Röntgen's discovery of X-rays, the first form of medical imaging. Suddenly, we could see through the opaque barrier of the body, revealing the skeletal framework within. This marked the beginning of a new era in medicine, the era of seeing inside. The development of CT scanning in the 1970s marked a pivotal moment in medical imaging. Godfrey Hounsfield and Alan Cormack, the pioneers of this technology, shared the 1979 Nobel Prize in Physiology or Medicine for their groundbreaking work. Unlike traditional X-rays, which provided a flat, two-dimensional view, kinetic scanning offered a revolutionary approach. It utilized a combination of X-rays and sophisticated computer algorithms to generate detailed cross-sectional images of the body. Imagine a CT scanner as a giant high-tech donut. As the patient lies inside, the scanner rotates around them, emitting a series of narrow X-ray beams. These beams pass through the body, and their intensity is measured by detectors on the opposite side. The data collected from these detectors is then processed by a powerful computer, which reconstructs them into detailed cross-sectional images or slices. These slices can be further combined to create a three-dimensional representation of the scanned area, providing a comprehensive view of the internal structures. This ability to visualize the body in 3 dimensions revolutionized medical diagnosis. Let's take a 3D cartoon journey through a CT scan. Imagine our cartoon patient, a friendly giraffe named Jerry, who needs a scan to investigate a mysterious tummy ache. Jerry lies on a comfortable table that slides into the CT scanner, which looks like a giant futuristic donut. As the scan begins, the scanner starts to rotate gently around Jerry. He hears a soft whirring sound, but it's not loud or scary. While the scanner spins, it sends out invisible X-ray beams that pass through his body. The clever computer collects all these picture slices and puts them together, just like a jigsaw puzzle, to create a detailed 3D map of Jerry's insides. CT scans provide a level of detail that traditional X-rays can only dream of. Imagine trying to find a tiny seed hidden inside a loaf of bread just by looking at the outside. It would be nearly impossible. But if you could slice the bread into thin pieces, you'd have a much better chance of finding the seed. That's what CT scans do for our bodies. They slice them into virtual sections, allowing doctors to see things that would otherwise be hidden. Doctors can use CT scans to find and identify tumors, assess injuries, and guide procedures. This X-ray vision is incredibly valuable for diagnosing a wide range of conditions. The impact of CT scanning extends far beyond the walls of the radiology department. It has revolutionized virtually every field of medicine, from emergency care and surgery to oncology and pediatrics. In emergency rooms, kinetic scans are invaluable for rapidly diagnosing life-threatening conditions like strokes, internal bleeding, and spinal cord injuries. For cancer patients, kinetic scans are essential for staging tumors, planning radiation therapy, and monitoring treatment response. Surgeons rely on CT scans to guide complex procedures, minimizing invasiveness and improving outcomes. The ability to visualize internal structures in 3 dimensions allows for more precise interventions, minimizing collateral damage and improving overall success rates. The story of CT scanning is still being written. Researchers and engineers are constantly working to improve this remarkable technology, making it even more powerful, precise, and patient-friendly. One exciting area of development is the reduction of radiation exposure. Newer CT scanners are being designed to use lower doses of radiation without compromising image quality, making them even safer for patients. Another area of innovation is the development of faster scanners. These ultra-fast CT scanners can capture images in fractions of a second, reducing motion blur and making them ideal for imaging organs that move constantly, like the heart and lungs. This fusion of cutting-edge technology with medical imaging promises to further revolutionize the way we diagnose and treat diseases in the years to come.